Okay, we're back. Calcaneocuboid joint. So this is our lateral transverse tarsal joint. So I'm going to find the calcaneus and the cuboid, something on each of those bones. So remember, when you follow the fifth metatarsal down, or proximally, you hit that tuberosity of the fifth metatarsal. The next bony landmark will be the cuboid. So on me, this is a little more proximal or posterior and a little more medial. And there's my cuboid bone. So that's one landmark, and the other will be the fibular or peroneal trochlea. So back onto the calcaneus, the calcaneal tuberosity, and then coming anteriorly or distally, and I have it right there. So again, it's that little shelf, little ledge type thing. And there's my cuboid. So I'm coming between those two landmarks, and I'm following it. I have the joint line here right under my thumb, and I'm coming medially. I can follow it onto the dorsum of my foot. And I'm going to go until about here, because I know that that joint lines up with the fourth and fifth metatarsals. I don't want to go over too medially or towards the medial side of my foot. So that's all I'm feeling for calcaneocuboid joint. So that's, the fibular or peroneal trochlea, the cuboid, and the joint line between them, following that onto the dorsum of the foot. And then lastly, we have the cuboidonavicular joint. So we're just finding between those two bones. So we know that on the navicular, on the medial side of the foot, we have the navicular tuberosity, and we know that on the cuboid, we have the cuboid tuberosity, or we can find the tuberosity of the fifth metatarsal first, and then head over to the cuboid. So you'll go onto the cuboid. Again, you know that the cuboid bone lines up with the fourth and fifth metatarsals. So you can stop between them. Right now, because my foot is a little bit actively dorsiflexed, I'm dealing with a lot of tendon here. But remember, you'll want your body's foot just relaxed as it can be. On the medial side, here's my navicular tuberosity. And so I will follow it onto the navicular bone to meet my other finger here. And I want to get my foot a bit more relaxed, so I'll let it drop there. And here's the joint line. So it lines up again with between my third and fourth metatarsals here. So for those last three joints, the foot joints, dynamic palpation will just be passive movement, a bit of wiggling of the bones that make up the joint. This is a really good picture to kind of visualize, use as a visual guide when you palpate the feet joint. So cuboidonavicular isn't shown here, isn't designated with a highlighted line, but it's right here. So cuboidonavicular, it's just we're meeting between these two bones. And then again, the subtalar, so we're looking at the lateral side. There's the fibular trochlea or peroneal trochlea. There's the blue is that joint line, so on the lateral side of the foot. The talocalcaneonavicular or medial transverse tarsal joint, we're heading to the sustentaculum tali. The navicular tuberosity, we're following the edge of the navicular towards the dorsum of the foot. For any of these joints that kind of dip away like this one does, so we're palpating it medially, and then as you come over a bit, you would stop palpating there, but you would acknowledge that the joint continues. Just say something like, the joint line continues underneath this as those bones articulate kind of inside or deep to that joint line that we're palpating.